Hi everybody, I am going to talk about locomotor disability. Locomotor disability or orthopedic impairment is the inability of an individual to move body parts freely. It could be due to injuries, diseases, or disfigurations in the bones or muscles. It could also occur due to an injury affecting brain, spinal cord, or the nerves of an individual. Impairments are problems in body function or alterations in body structure such as paralysis, missing limb, or blindness. In India, there is a huge number of people affected with locomotor disability. Today, much advancement is happening in the field of medicine. Opportunities for assessment and intervention or treatment, social inclusion of the persons with a disability, and awareness about the disabilities and their management. At the end of this talk, you will know the meaning of locomotor disability, understand the causes of locomotor disability, gain an insight into the management of disability, and grasp the role of social workers in the rehabilitation of the persons with locomotor disability. Let me briefly explain the meaning of locomotor disability. According to the Persons with Disabilities Act 1995, locomotor disability means disability of the bones, joints, muscles leading to substantial restriction of the movement of the limbs or any form of cerebral palsy. The Rights of Persons with Disabilities Bill 2012, which is yet to become an act, has defined locomotor disability as a person's inability to execute distinctive activities associated with the movement of self and objects resulting from affliction of musculoskeletal and or nervous system. According to the Individuals with Disabilities Education Improvement Act 2004, orthopedic impairment is understood as a severe orthopedic impairment that adversely affects a child's educational performance. The term includes impairments due to the effects of congenital anomaly, impairments due to the effects of disease, and impairments from other causes such as cerebral palsy, amputations, and fractures or burns that cause contractures. In 1980, World Health Organization defined locomotor disability as a disability to an individual's ability to execute distinctive activities associated with moving both himself and objects from place to place. According to the Census of India 2011, about 2.21% of the total population is found to be suffering from one form of disability or other. Out of this, disability in movement emerged as the highest category with 20.3%. The census also revealed that locomotor disability is more among men than among women in India. Also, the rural India has more number of people with disability in moving compared to the urban India. There are different reasons why a person can have difficulty in movement. Different agencies working in this field have tried to classify the different diseases which cause locomotor impairment based on different criteria. It can be broadly divided as congenital and acquired. Congenital include cerebral palsy, clubfoot, and muscular dystrophy. Acquired disability can be caused by polio, osteomyelitis, accidents, trauma, and so on. The major causes can be classified as the cerebral palsy, poliomyelitis, osteomyelitis, muscular dystrophy, tuberculosis of the spine, spina bifida, clubfoot, cleft lip and palate, angular bone deformities, and accidents, trauma, injury. Let me describe each of these causes of locomotor disability. Cerebral palsy is understood as a group of chronic conditions affecting body movement, muscle coordination, and often mental capability. It refers to several non-progressive disorders of voluntary movement or posture that are caused by malfunction of or damage to the developing brain that occurs before or during birth or within the first few years of life. In this condition, the brain's ability to send messages gets affected and therefore loses the coordination of body movements. It lacks the ability to control the muscle, and even the ability to speak gets affected. Individuals with cerebral palsy have abnormal, involuntary, and or uncoordinated motor movements. There are four most common types of cerebral palsy, which are known as spastic, athetoid, ataxic, and mixed. Spastic type refers to the condition of very tight muscles occurring in one or more muscle groups that result in stiff, uncoordinated movements. Athetoid type occurs when movements are contorted, abnormal, and purposeless. Ataxic type refers to the condition of poor balance and equilibrium in addition to uncoordinated voluntary movement. Mixed type indicates any combination of these types. Cerebral palsy is also classified by which limbs are affected. Major classifications include hemiplegia, diplegia, paraplegia, and quadriplegia. Cerebral palsy is not a disease and hence cannot be cured. However, the use of aids such as wheelchair, walking aid, and physiotherapy can help in the mobility of the individual. Poliomyelitis, shortly known as polio, is a highly infectious viral disease caused by the poliovirus that affects the nervous system and can cause paralysis of the arms, legs, or trunk in few hours' time. It mainly affects children under 5 years of age. The virus enters the human body through the mouth and multiplies in the intestines. It can result in respiratory failure, paralysis, and even death. It can be prevented by immunization of children. The polio eradication program, named Pulse Polio Program in India, has found results, and India has been declared polio free. Osteomyelitis is a bone infection caused by bacteria and other germs. It is a chronic bacterial bone and joint infection that progressively destroys the bone and may also affect the joints. Normally, the bone is resistant to bacterial infection, but surgery, placement of prosthesis, trauma, and so on can make the bones vulnerable to infection. It can lead to severe physical impairment if not treated properly. Malnutrition, poor hygiene, diabetes, extensive scarring, chronic wounds, and so on are some of the risk factors for developing osteomyelitis. Antibiotics can help in the early stages of infection. Surgical removal of infected bone and tissue is required once the infection becomes chronic. Muscular dystrophy is not one disorder but rather a group of diseases. It is a degenerative or progressive disease that gets worse over time. The person's muscles become weaker and waste away over time. Some forms are seen in infancy or childhood, while others may not appear until middle age or later. There are three main types of muscular dystrophies. Duchenne muscular dystrophy is the most common form and it occurs primarily in male children. It is caused by the absence of dystrophin, a protein involved in maintaining the integrity of muscle. The onset of this type is between 3 and 5-year-old children, and the disorder progresses rapidly. It starts with the difficulty in walking, climbing and so on, and later need a respirator to breathe. Facioscapulohumeral muscular dystrophy usually begins in the teenage years. It causes progressive weakness in muscles of the face, arms, legs and around the shoulders and chest. It progresses slowly and can vary in symptoms from mild to disabling. Myotonic muscular dystrophy is the disorder's most common adult form and is typified by prolonged muscle spasms, cataracts, cardiac abnormalities and endocrine disturbances. Individuals with myotonic muscular dystrophy have long, thin faces, drooping eyelids and a swan-like neck. There is no specific treatment to stop or reverse any form of muscular dystrophy. Physical therapy, respiratory therapy, speech therapy, orthopedic appliances used for support, corrective orthopedic surgery and occupational therapy and so on can help the individual lead a better life. Tuberculosis of the spine is one of the most common spine pathologies in India. This is an infection of the spinal column that progressively destroys the backbone and causes severe physical impairments. The disease is caused by the tubercle bacillus. Tuberculosis of the spine occurs when a tubercular infection of the lungs spreads to the spinal bones. This frequently happens in children. The infection can be cured with anti-tuberculosis medicine, but extensive surgery is often necessary to stabilize the spine, correct deformity, and allow recovery of the spinal cord. Spina bifida is a disability that is present at birth. It occurs when there is damage to the spinal cord and the column does not close completely, causing an impairment of lower body movements, functions such as bladder or rectal troubles, and even paralysis. It may not affect intellectual functioning. There is no cure for spina bifida. The nerve tissue that is damaged cannot be repaired, nor can function be restored to the damaged nerves. The clubfoot is a condition in which the child is born with the foot turned inwards and pointing down. Either one or both feet may be affected. If left untreated, the condition causes the person to walk painfully on the top of the foot. The majority of clubfoot cases are congenital or hereditary and result from abnormal development of the muscles, ligaments, tendons and bones while the baby is being formed in the uterus. Cleft lip and palate is a common congenital deformity. It occurs when the separate areas of the face that develop individually and then join together do not join properly. A cleft lip is an opening between the upper lip and the nose and looks like a split in the lip. A cleft palate occurs when the roof of the mouth has not joined completely. The conditions may occur separately or be combined. Angular bone deformities are bent bones, most often occurring just above or just below the knee. This condition causes severe knock knees or bow legs that develop and worsen with growth. The deformities may make walking difficult and damage the joints, resulting in arthritis. Accidents, trauma, and injury can cause severe damage to spinal cord, limbs, or body, leading to impairment in movement. Spinal cord injury is a major issue among accident victims, leading to paralysis or even death. Domestic accidents, industrial accidents, fall from buildings, road accidents, and so on can lead to impairment in movement. Let me now talk about the management of locomotor disability. In a developing country like India, rehabilitation and treatment of locomotor disability is challenging as it is not easily accessible to everyone, particularly the rural India. Management of locomotor disability should start from the prevention of its occurrence. Care should be given to reduce the chances of occurrence of the impairment. Promotion of general health and well-being, immunization, and lifestyle modification can help. Once the disability has occurred, priority must be given to detect and treat it at early stage. Next, the person must be given medical, psychosocial, vocational, and educational intervention to help him or her lead a normal life. It is important that the individual is able to lead a life as normal as possible in the society. Like in any other disease, early detection is an important factor in locomotor disability. Awareness education is important at schools, health centers, and even at homes. Rehabilitation of people with locomotor disability happens based on the degree and the extent of the disability. Orthotics and prosthetics are aids that support in rehabilitation of locomotor impairments. An orthosis is a correct term for an externally applied device that is designed and fitted to the body. Orthotics generally include most devices that correct, improve, or support body abnormalities to achieve one or more of the goals. Let me mention about the functions of orthotics towards body abnormalities. They control biochemical alignment, correct or accommodate deformity, protect and support an injury, assist in rehabilitation, reduce pain, increase mobility, functionality, and independence. A prosthesis is an artificial device attached or applied to the body to replace a missing part. It can also supplement an existing but defective body part. Prosthesis can be for internal or external use. Internal prosthesis includes heart valves, joint replacements, and so on. The external prosthesis includes upper and lower limbs that have been amputated. Another important rehabilitative assistance is walking aids. It helps increase the mobility of the patient as they enable some of the body weight to be supported by the upper limbs. Different types of walking aids are parallel bars, crutches, walking frames, sticks, and so on. Wheelchair helps in the movement outside. Let me discuss about the role of social worker in the rehabilitation of persons with a disability. As early detection is crucial in the management of locomotor disability, social workers should be able to identify individuals with a disability, especially in the community. It is crucial to direct them to the available resources like healthcare facilities, rehabilitation avenues, places for aids and appliances to help in rehabilitation. They should create awareness about the disability and the importance of integration of the individual back into the community to help lead a normal life. Social workers can help community and authority set up disabled friendly settings like ramps, special toilets, low-level stairs and so on in schools, public places and offices. They can sensitize the community and help to remove the stigma associated with locomotor impairments. They can disseminate information about the various therapies like physiotherapy, occupational therapy and so on for persons with locomotor disabilities, the effectiveness of which can help the persons in leading a better functional life. Social workers can take to social advocacy and ensure that the persons with the locomotor disabilities get suitable jobs as per the reservation policy of the government. Let me sum up. Locomotor disability or orthopedic impairment is the inability of an individual to move body parts freely. Locomotor disability is defined as the disability of the bones, joints, muscles leading to substantial restriction of the movement of the limbs or any form of cerebral palsy. It could be due to injuries, diseases, disfigurations in the bones or muscles. It could also occur due to any injury affecting brain, spinal cord or the nerves of an individual. Impairments are problems in body function or alterations in body structure such as paralysis, missing limb or blindness. In India, there is a huge number of people affected with locomotor disability. According to the Census of India 2011, 2.21% of the total population is found to be suffering from one form of disability or other. Out of this, disability in movement emerged as the highest category with 20.3%. The census also revealed that locomotor disability is more among male in India than among the females. Also, the rural India has higher number of people with a disability in moving compared to the urban India. Individuals with a cerebral palsy have abnormal, involuntary and or uncoordinated motor movements. There are four most common types of cerebral palsy. Cerebral palsy is not a disease and hence cannot be cured, but use of aids like wheelchair, walking aids and physiotherapy can help in the mobility of the individual. Management of locomotor disability should start from prevention of its occurrence. Care should be given to reduce the chances of occurrence of the impairment. Promotion of general health and well-being, immunization, lifestyle modification and so on can help. Like in any other disease, early detection is an important factor in locomotor disability. Awareness and education is important at schools, health centers and even at homes. Once a disability has occurred, priority must be given to detect and treat it at an early stage. Next, the person must be given medical, psychosocial, vocational and educational intervention to help them lead a normal life. It is important that the individual is able to lead a life as normal as possible in the society. Rehabilitation of people with locomotor disability happens based on the degree and the extent of the disability. Orthotics and prosthetics are aids that support in the rehabilitation of locomotor impairments. Social workers can help the community or the authorities set up disabled-friendly settings like ramps, special toilets, low stairs, in schools, in public offices, and so on. Educating the community to remove stigma associated with locomotor impairment can be taken up by social workers. Awareness creation about the various therapies like physiotherapy, occupational therapy and its effectiveness and impact in leading a better functional life can be done by social workers. Let me sign off now and hope to see you in another session. Thank you.